Hello. Alright, sure. Hello, everybody. Just waiting on Cola to hop in. It's a whole bunch of topics today. We're just waiting on Cola to come in. She keeps all of the questions. So, why is she unable to join? Try one more time. What's happening? So, if not, we'll just have people hop in, and I'll just get to talking and answering questions till she comes in. But she should be in a second. Mm-hmm. Huh. Usually she be ready. She the main one that told me. Put it on my calendar, put it on my schedule, and now she not picking up. I might have to bring my child in here. She can hop on and let her get in here and entertain and ask questions. Well, Cola's unable to join. I don't know what's her issue. Well, let me bring my child in.
Daddy, hey,
What's happening?
what's up?
Now you prime time live. What you doing?
Guys, I just got out of practice. You guys want to see my socks?
No, they
How
don't want.
dirty they are.
Come on, baby. Come on. You got. Don't embarrass me. Don't embarrass me.
No, I have to play softball. My cleats are. I play on a dirt field.
I understand that you can't embarrass your dad though with dirty socks.
How's that embarrassing? Sarah, say hi, guys. That's Sarah. Oh
Hello,
my God! Everybody's about to start joining because when
yeah, you like to start the whole show.
No,
Everybody likes to hear Pearson.
that's not fair. My coach. Well,
Got you.
last time you said you were gonna.
Your question about hysterectomy 50 and hormone replacement, I'll answer that. We just stalling to Cola get herself. All right. So, are you aware of the higher rate of stillbirth for Black mothers? Why do you think that is? I will answer that. That's a very good question, and that has a lot to do with bias and discrimination. Has a lot to do with medical bias. Honestly, we'll talk about that too. You have any questions, child, that you would like to ask for today?
Do I have any questions?
Yeah, you have any questions? You want something you want to talk about?
No, I can help you answer questions.
You can help me answer questions?
Yeah.
All right. Well, let's start there. Let's talk about who's starting today. So one of these people stop being silly. So somebody was asking about like hysterectomy after 50 or like menopause at 50, and do you need hormone replacement, or what's the thought about that? What's your thoughts, baby?
What's my thought about hormone replacement at 50?
Mm-hmm. Or if you have a hysterectomy, like what I taught you about, like hysterectomy and your uterus, your ovaries, and that stuff. Like, what are your thoughts as far as, do you think you need hormones or not? Where do hormones come from? How about that?
I think that hormone replacement would be for most women. I think most women would prefer hormone replacement. I would probably prefer
They
hormone
prefer,
replacement.
but do they need it is the question.
Not necessarily.
Yeah. Where are your hormones produced? Where your hormones come from?
Hold on 1 second. I'm in the locker room. Give me 1 second. Can you hear me?
Yeah, we can hear you. Everybody can hear you.
Okay, hold on, because my service is gonna cut out in a second. Guys, I'll be right back.
Anyway, so I don't know what Cole is, but we're just gonna keep it going. So hormone replacement, right? So do you need hormone replacement after you have a hysterectomy or when you hit menopause? And so answer to that is no, not necessarily. So when you have a hysterectomy, it means removal of the uterus, right? That's hyster is uterus, right? So ectomy is removal of something. So when you have hysterectomy, you're just removing your uterus. Your uterus has absolutely no bearing on if you have hormones or not, or it does not release hormones. It's all from your ovaries, right? So if you have a hysterectomy and you keep your ovaries, then you should not need hormone replacement, with the caveat. So when you have, at every woman's life, I don't care who she is, right? Your ovary, even my child right now, her ovaries are starting to do this. Even at her young age, her ovaries are starting to decline. We live to die, right? That's what happened. The same thing with your ovaries. As you approach menopause, or when your ovaries start to fail, that means they stop producing hormone, and then from there you can start to have symptoms, right? Those symptoms include hot flashes, vaginal dryness, those things like that can happen. Does that mean you have to have hormone replacement therapy? No, it does not. Because if you have 100 women, and I'm using rough numbers, so anybody that's OB or in medicine, don't quote me as far as like exactly the numbers. But in my experience, if you have 100 women, right, and they all go through menopause, meaning the ovaries start to fail, a very, very, very small percentage of those, maybe 10, will have, out of the 100, will have it to where they don't have any symptoms. No hot flashes, no vaginal dryness. They just stop having periods and they just keep it moving like nothing ever. An overwhelming majority of those women, like 80, let's say 80 is a great number. 80 of them will have occasional hot flashes, will have occasional hot flashes, a little bit of vaginal dryness, will have some issues, but it does not stop their regular activities, right? So their quality of life is not compromised, nothing is happening. So they don't really need medications. They don't need hormone replacement. They don't need anything. They have an occasional hot flash, keep movement, i.e. grandma. Right?
I think that there's actually a lot of women who like eventually either stop having a period or like have really irregular periods, and I think it's more common than people think.
It is.
Like a lot of people.
It absolutely is. You want to know why that happens, though?
Go ahead.
Right. So it happens like that because your periods are a byproduct of your ovarian hormone production, right? So your ovaries are going to produce hormone to build up the lining of your uterus in preparation for implantation of a fertilized embryo. And then if that doesn't happen, which is pregnancy, if pregnancy doesn't happen, then hormones are released and then the lining breaks down, right? That's where your period happens every single month. Get ready for pregnancy, pregnancy doesn't happen, it breaks down. Get ready for pregnancy, pregnancy doesn't happen, it breaks down. Every single month that happens. That's what your menstrual cycle is. Unless you have medications, which basically trick the body into believing those things are happening when they're not, or you have some other type of pathologic process, whether it be thyroids, pituitary, whether it be parathyroid. There are different medical conditions in your body that will interrupt your cycles or make them longer, make them shorter, make them not come at all. Those things happen. Physiologically or regularly, what happens in every single woman is that at a certain point, your ovaries stop producing the same amount of hormone. That's not you. Cool out. What? I can't hear you. You went mute.
Oh, I was trying to stop you. I wasn't saying that's
All
me.
right. So stop. What?
Um,
Okay.
there's because I bring I my it notifies people that follow me when I go on live. So there's a lot of people here my age, even guys, and I think now is a great time for me to talk about birth control
I will
and
talk
teen
about birth
pregnancy.
control.
But you
That's a
should do it
phenomenon.
now because nobody's gonna stay on.
Nobody's gonna listen to. So can I finish this point? Will they stick around so I can finish this point and then I can talk about birth control next? Is that okay?
Okay.
Okay. So when a woman's ovaries start to fail, right, meaning they're not producing the same amount of hormone, they don't ovulate the same, right? So if they don't ovulate normally, then it can throw the periods and cycles off. So to Pearson's point, what she was talking about is when you get late 30s, early 40s, mid 40s, everybody's a little bit different. What can happen is that you have really, really heavy periods, really abnormal periods that come twice, three times a month. And that typically, if it's all of those the other factors are not the same, or all those other factors are normal, what that can indicate is that you're not ovulating regularly. So that's called anovulatory bleeding, meaning that you're not ovulating normally like you used to because of the ovaries are starting to lose function, and it can cause you to bleed abnormally. So those are the things that can happen with it. You don't necessarily need to have medications. Sometimes it gets bad enough for medication. Sometimes it gets bad enough for surgery. To your point, my dear, birth control. So in 2023, there's absolutely no reason on the face of the earth, and this goes for everybody that has kids that are on here, the friends of my child that are on here, that goes for everybody. Like, there's no reason to have a unintended, unwanted pregnancy, right? You have so many options for birth control that were not afforded to us years and years and years ago that are pretty much as effective as a tubal, almost. Like, they're really, really effective. So if you truly, truly, truly do not want to have children, don't want to get pregnant at a particular time, I strongly recommend long acting reversibles. So Nexplanon, which is a device that goes in the arm, which people kind of freak out about, but it's no different than your earring, nose ring, or any other ring that you have. Just keeps you from getting pregnant for 3 years. And then you have IUDs, which go into the uterus, which are a little bit more invasive, which are much easier for women that have had babies, a little bit harder for women that haven't had babies. That's why they have Nexplanon. But IUDs last for 3 years, 5 years, 6 years, 7 years. They have all different IUDs that last for different periods of time that will almost 100% prevent you from getting pregnant. So I don't recommend birth control pills. When my child starts to become sexually active, she will not be on birth control pills. She is on here right now, and I'm saying this to her face. Any other kid or any other parent of any other child, like, I don't recommend it. We can't remember to take multivitamins every day. I miss my multivitamin today. It's hard to remember to do something every single day when you are relying on a child, teenager, young adult who's super busy, that has things going on, to take something at the same time every single day, all the time. It's you're just setting up the possibility of failure. It just doesn't make sense. You forget your birth control pill, then it's a strong possibility that you can get pregnant. So with that being said, I wouldn't recommend birth control pills to any young person. If you are going to do something more shorter acting like that, they have a NuvaRing, which is the vaginal insert that you put in the vagina, which will last for 3 weeks. Take it out for the last week, just like the placebo for birth control pills. They also have the patch, which is much better than what it used to be, but it's similar in function to the birth control pill. But you don't have to take it every day. The whole goal is do not have to take something every single day at the same time every day for it to be effective, because most people just don't remember to do that. And last but not least, you have Depo-Provera. Depo-Provera is the shot that lasts 3 months. Very effective. People complain about weight gain and weight gain from it. It does not it does not specifically cause weight gain. What it does is it increases a hormone called ghrelin, and that hormone causes you to be hungry, right? So hunger causes you to eat more, which then causes you to gain weight. If you keep your same diet, same activity level with Depo-Provera, then you typically do not gain weight. But that's the hormones. I mean, that's the birth control in a nutshell. For all you children,
Wait.
don't have sex. How about that? Go ahead.
No. You can't say that because people are gonna have
I
sex
understand
regardless. So you're
that,
wasting
but
your breath.
how about we just make good choices? How about that?
How about safe sex is good sex?
How about I have multiple pistols and I will shoot you? How about that? You like that? You like that answer? How about that? And how about any male or any boy that's listening to me and know that I will go to jail and I'm crazy
No.
and I will throw all of
All
this
right,
away.
stop now.
If I
Stop
ever
now.
slay the doc for the street, I will throw all of this away. Trust me. What Martin say? You ever been with a man you want to? Like yo, don't play with me. I'm not wrapped too tight when it comes about my child, but I will shoot you, just so you know. On
Anyway,
live.
people are asking,
Yeah. What they ask? What they want to know?
wait. Someone said something that was a good point.
What?
They said, they want you to speak on the effects of long-lasting birth control, because I know a lot of people who don't, a lot of people who think that birth control is like a medical.
Look at that. Look at Lake McGraw.
First of all,
Look at
Dr.
Lake
John,
McGraw. Look how many times I gotta invite you. Oh,
I
hold on.
told
I'm
you
gonna get you in the
I
pit.
can't.
Let me talk about
That
this one
looks
here.
like it's my cue to go.
No, it's not your cue
No.
to go. No, ma'am. I'm going to finish with you. We're gonna talk about the effects of
long-lasting birth control, because there's a lot of people, especially my age,
Talk about
who
that.
think that. Hold on. Who think
No, I'm
that?
gonna get to her in a minute. Talk about you. Go ahead, baby. I'm sorry. You breaking up. You breaking up. Get to a place where we can hear you. Hold on. We're gonna talk when you get your phone together.
Hold on, can you hear me?
Yeah, I can hear you better now. What
I
happened?
said a lot of people my age think that birth control is like a tactic used by medical professionals, like to like con you into, I don't know, putting something artificial into your body.
Oh.
And I've heard a lot of people say that, and I obviously all I can say to that is, like, if you don't want birth control, just have kids and just risk it. But
wow. Well, what? All right. So, think about it. I'll tell you to think about stuff logically, right? Like,
I'm not against birth control.
No, I get it, but I'm saying just for all those people to think that every one of them, they have cell phones that they stay on for hours and hours in a day. Is it easier to track you through your cell phone through optimization and all of the things that they have to track you on your cell phone, as opposed to putting a device in your arm? You can get tracked on your cell phone. They don't have to, like, conspiracy theory and birth control to track you. Like, they can do that anyway. You gonna use your cell phone, they can track you that way. Like, it's just nobody is going to track you with birth control. It's not a conspiracy theory. It's the same way that nobody wanted to get the vaccine. Everybody's like, oh my God, it's a conspiracy. They trying to track us. They putting microchips in our bodies and yada, yada, yada. The same folks are getting these weight loss injections. Same folks that will take any amount of money, any pill that any of the same drug companies are producing to lose weight or do any of the desired effects that they want. Off-label stuff, taking diabetes medications to lose weight now. Like, same people that didn't want the jab, pharmaceutical companies are trying to kill us and all this other stuff, but the same people that will take that stuff with absolutely no problem. So, no, birth control, like, has been around a long time. Like years ago, I worked at Mercy Hospital, which is like close to Chinatown, and
I watched him deliver a 15-year-old child's baby, and the dad was like 17. I kid you not. Everyone was watching this. I'm I don't think I've ever publicly told this story before, but I was going on rounds with him one time, and he literally post-opted a girl who was younger than me. She just turned 15, and I was on my way 16. She just turned 15. Had a
So
kid.
imagine you having a child right now. Imagine that. Exactly. That's why birth control is important.
Exactly.
Because people are going to die
That's
and I
why.
want to go to jail.
That's why safe sex is
No.
important.
How about safe sex is important, but pistols are important too. Don't think they're not.
Don't get canceled on Instagram Live.
I shoot the kids. Go ahead.
And for everybody who knows me that's watching, he's
Dead ass.
not.
Dead ass.
We own no guns in the house. We are a safe family.
Okay. Yep. Anyway,
bye, guys.
moving on. Goodbye. Have a good practice, child. Goodbye.
Your
Go
life
away.
will be over after having a baby young. No sex till marriage.
Thank you.
Your life won't
Appreciate
be over if you have a baby young. I don't want kids.
Thank you, man.
I want one. No
Are you
sex
done?
till marriage.
Are you done? You said
Yeah.
you said you. All right. I'll talk to you later. Be safe. Goodbye.
Bye.
Back to you, ma'am.
No, so you just not reading my messages no more?
What you say?
You just not reading my messages no more?
It's hard to read your messages when I'm actually on the live. Well,
no.
Like
I reached out to you at like four something.
You know, I do consults, and I do a million things.
So you're admitting that you're not listening to messages no more.
I mean, I'm following the time that I'm supposed to be on here. I got off a consult F5 and got on live right away. You see how that worked? Boom, boom, boom. You know, the time I was supposed to be on that you told me put that in your calendar and don't forget that part.
Well, I have to do that with you because what usually happens.
Now, see, it seems like you got to do this with yourself. So it's somebody that.
I alerted Dr. Johnson early that I was running behind. I was being super IT girl tonight, and I had to get an upgrade rolled out. So
I'm gonna. Can I accept this person that wants to come on?
Yes, you can.
I tried.
Hi, mommy.
Hey, music.
It's
daughter
night. It's kid
day.
Look at that. Look at
I wanted to get on here because, well, I'm not even gonna say. I said team no birth control, but I don't even want to fight about it.
Wait a minute. Whoa. Whoa. I'm
against it, but I don't want to argue. I don't want to argue with you about it. So
you ain't got to argue with me. You got a whole mama. Go ahead. Oh, is that a baby?
What's that in the background?
Is that a background, man? What was that? What'd you say? Hold on. What? What was that? Was that birth control making noise back there?
Well, that's what I'm saying, because I got pregnant on birth control. So
no, what birth control were you on?
One,
mommy, don't.
That she was not taking every day at the same time. Exactly.
Tell the truth, devil.
Look at me. You see, but I wanted to come on here and share my story of my delivery with you.
Okay.
I'll show baby Legend. He's 1 now, so it was a year ago.
Look at that. What's up? Causing trouble.
Hi, Legend.
Hey, little nugget.
But I wanted to talk about how my delivery went with Doc P. It went. I got lucky that you were there, because I remember being in the room and I told them that they said that you were coming the next day, and I was like, oh, I want to wait for him. And they said, and the doctor got mad because she wanted to deliver. But I was nervous because I was afraid that she was going to try to give me a C-section, and I ain't want that.
Yeah, it happens.
And my mom told me that you push for that not to happen. Make sure we able to Legend.
No, that's birth control. Let it talk. No, let them go ahead.
But
Go ahead.
I just wanted to say my delivery went very good. I ended up with only with one stitch from listening.
Yeah,
To
so
the guy.
to that point, so y'all are, whoever is listening to this, you are in a delivery, whether it's you, whether it's any family member, when you're delivering, this is what you need to remember, right? Everybody's like, push, 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 and the baby's right there, and y'all, everybody in the room is screaming, push, push, push. That push at the end, without like controlling it and relaxing, will cause you to have significant tears. Everybody needs to relax, including the doctor. So if through that whole thing, everybody's telling you push, 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 and not to relax at the very end before it comes out, that means you're going to that's when possible big tears can happen. So you got to relax. Like
I mean, I don't even know how I did it, but I just was listening and not trying to rush it.
That's good. Well, we glad little birth control popped on out. And
I want to say Doc P almost dropped him.
never
Shout out.
drop.
Yes,
Zero ever.
I mean, he was looking a little slippery in the arms. I don't know.
Hey, fumbles don't count. Drops the only thing count. I have 0 drops.
No, he dropped.
0.
That one arm did look a little slippery.
0 drops. 0 drops. 15 years. Won't happen.
But no, it was definitely a good experience. And
so we coming back to do this again?
No, not for a long time.
Okay, we don't like birth control, so hey, we
I will be back, and I'm careful.
Oh, careful. Wow.
Yeah,
accidents.
That's what you wanted before, right?
Right. Accidents can happen even on a short trip.
No, it's called practicing abstinence. That's the only 100% way not to get. That's the best birth control.
Yeah, okay.
Yeah, not the TikTok advice.
Okay. Okay. Well, thank you for hopping on, man. We appreciate you. Kiss the baby. Kiss the baby from me.
Vicky.
See you later.
Birth control loud.
I bet she listening to me now.
Right. All right. What questions you got?
All right. So
somebody asked a question that I missed. I forgot. Somebody said something. There was one more question somebody put up on here. I forget. Keep going.
Okay.
Let's see what you.
I was gonna say that I definitely sorry for the delay. I did let somebody know that I would be late, but some people, just working with our people sometimes. But if you have a question tonight, you can hop on the live, share a story, share an experience, ask a question, get a free consultation on the site. You can also drop a question in the question bubble. That way, if we don't get to everything in the allotted time, we have record of your question and can save it for the next free game session. And then I also have ones that people have submitted since our last live, and that list is an ongoing list. So you had a question in there already?
Am I aware of higher rate of stillbirth for Black mothers? Have I seen that? Yes. So of course, I mean, it's everywhere, and this is true. So why is that? There are a multitude of different reasons why that is. The government and people that don't really want you to know the truth will say that, oh, it's just by happenstance. It's just like we've done studies. We don't know why Black women are having more stillbirths or what have you. And that's not the case. There's a couple of different reasons that I could tell you. Number one, healthcare disparities, right? So it's lack of access to good care, lack of access to adequate facilities, lack of access to prenatal care, like people that actually care and are invested in Black women, right? So when you look at socioeconomic status across the board, we have lower socioeconomic status, which means lack of resources and access to adequate care. Number two, there is a mistrust of the medical system, as well as it should be, because there has been centuries of abuse and horrible treatment of Black people, in particular Black women. So those stories have been passed down generation to generation to generation to present, to where Black women don't necessarily trust physicians, and in addition to not trusting physicians that don't look like them, so a lot of times they're not going to the doctor regularly, and not trusting their doctor, and because there are not enough people that look like them in spaces to take care of them. And again, it's also a lack of knowledge and misinformation. So, you know, a lot of women will see that a lot of people are having regular birth, having childbirths that they can do at home. They can have water births. They can do a lot of things without doctors. Who needs a doctor? Why do I need to go to a doctor to have a birth? But what we don't talk about at all are preeclampsia, eclampsia, maternal hemorrhage, uterine atony, shoulder dystocias. We're not talking about those things enough, because an overwhelming majority of deliveries are normal, no problems, no issues. There are still a large number of those things that have complications, have major issues that we never talk about. We only focus on the good and don't focus on the bad. And so when you have the misconception that it's always good, and you have people that are online, that are on, you know, blogs and things saying, you don't need the doctor, just deliver the baby at home or what have you. Yeah, it might be, you got a 70% chance that everything will be okay. But if you had a 70% chance that you could get in your car and drive to your destination, but 30% chance that you wouldn't, would you drive all the time? No, you wouldn't. Right? You wouldn't take 70% chance of anything else, but you would do that with childbirth just because you want to do it at home. Doesn't make much sense. There are too many risks involved and too many bad things. I've seen women die. I've seen women have major problems. I've seen babies die. I've seen a lot of things happen because of misinformation. So understanding the information and understanding how to get access, how to attain proper care, is extremely important. But those things all factor into why there's a higher rate of stillbirth, maternal mortality, infant death, and morbidity. All of those things are elevated when you look at Black mothers and Black children. So it's not just stillbirth, it's all of those things. So hopes that answers that question. Still mycin. Okay, keep it in mind. Next.
Do you know any natural birth control?
That works?
Well, they didn't put that part, but
I mean, yeah. So there are a couple of different natural birth controls. Understanding the ovulatory cycle and understanding that there's only a 20% chance that you can get pregnant per month. Even if you just have sex every single day, you only got a 20% chance that you'll actually get pregnant in a month, right? There's only 5 days out of the month in which you can get pregnant. So just by law of averages, if you know those 5 days, if you have sex outside of those 5 days, then you really won't get pregnant. You just have to know when those 5 days are. So timing ovulation and coitus timing, or timing your intercourse around times where you're not ovulating, is a way to naturally control childbirth. Like Mormons, people that don't believe in birth control, do this all the time. They just really time the times in which they can get pregnant. Withdrawal or pull out, like, does it work? Yes, it does, but you have to have a lot of control to be able to do that. If you don't have that control, and not a lot of men do, they'll lie to you and say they do, but they don't, which is why we have a lot of these babies that are just running around here because, pull-out game. No, pull-out game is trash. So you just have, that is another method. But in addition, so quote unquote natural, there is a vaginal insert now that's out. I'm blanking on the name right now, but it is also extremely effective. It's not quote unquote natural, but it is a method that is not a medication that's basically, killing the sperm and stopping the sperm. It's kind of like a spermicide, but it's not. It's a new Imvexi. Imvexi? Yeah, Imvexi is the name of it, but it is extremely effective at preventing pregnancy, which is another one. So those are, and of course, condoms and barrier methods, diaphragms, Female condoms, like all of those things are, I guess, natural ways, if you will, since they're not actually systemic medications. They could be considered that. So that should answer that question. What's next?
Okay. Desi Horton says, please don't forget me. So is she joining?
She should. So she had. Hold up. I don't know. Did she just ask her? Wait a minute.
Can you click on the button to say request to join, Desi?
So it's like it's some the correct educate on the correct way to use Plan B. That's a good question.
That is a good one.
If you want to get pregnant.
Oh, she said I'm not joining. I'm at my text. Sorry. I'm sorry, Desi. I thought that you had just joined and said that at the same time, so I thought she was coming on. I'm sorry.
What she asked about, is there a certain way to make a baby girl?
Oh, I don't know.
That's what
she said. She said you got the text.
I did. So she asked, is there a certain way to make a baby girl? Okay. So anybody that's in medicine or like that wants to fact check and do all of that stuff, like, don't, like, this isn't for you. Like, so what I am about to say is makes sense physiologically, but it is not like a surefire method at all. So especially for people that want to have males, right, or get pregnant with a male child, the best way to do that is, and this is super free game, I need to charge for this shit, but anyway, so the best way to do that is to abstain from intercourse and just have sex one time at ovulation. And the reason that works is because the male semen swim faster, and if you basically store them and you just basically shoot at the same time, they have a higher likelihood of survival and getting to the egg first, right? But if you have multiple ejaculations, right, you decrease the male sperm and you decrease their ability to get there quickly. So I had an attending, not where I learned this from, I had an attending in residency that had 3 male sons that he took care of all of, he did everything. He's a Middle Eastern guy that, like, he delivered his own kids, like he closed the door, like he was in the hospital, like he just cut everything off, like he just had everything, had a whole process. And he broke that down to me, and sure shit, like every single time, had a male. He just basically abstained from sex until ovulation, had sex one time, boom, knew exactly when she was ovulating, had males every time. So that is a theory that makes sense, that I would recommend. If you really, really, really want a male and don't want to pay $30,000 for it, you should try that. But it's not surefire. Don't come to me if it don't work. I don't want to hear it. So if you want a girl, just have a bunch of ejaculations, and around ovulation, let that go, and then your girl semen or your X chromosome semen will have a higher chance of getting to the egg. That's it. Again, that's not 100%, but that is how to do that. So you recommend someone build for hernia, was even move, separate the blood type of both 2 separate surgery. So hold on.
You can't read the questions to yourself.
No, I'm just seeing if it's something I need to answer. So can you educate on the correct way to use Plan B and to end the decrease in effectiveness when weighing over 170 pounds? Black women tend to be thicker, and here come baby. Okay. So Plan B, what does it do, right? So Plan B is a very, very high dose of synthetic progesterone that is aimed at preventing ovulation. How does it do that? When you ovulate, what's happening in your body is that the estrogen builds the lining of your uterus, and then in the middle of your month or of your menstrual cycle, the entire thing, not your cycle, but in the middle of the month after your period, there is something called a LH surge. The LH surge is a hormone that's released from the brain down to the ovaries that causes a spike in progesterone, which then causes an egg to be released from the ovary. That egg released from the ovary clearly can be fertilized, and that's how child birth and pregnancy happens. Plan B is designed to mimic that LH surge, or that hormone release from that hormone release from the pituitary gland never happens. So it stops the LH surge by basically increasing the levels of progesterone really, really high, so that it tricks the brain that you already ovulated when you really didn't. The problem is, and why Plan B is not always 100% effective, is because if you already ovulated, guess what? It's coming. So the key is that it's such a, if you take it right thereafter or within 24 hours or whenever it is, the likelihood or the probability that you have already ovulated is extremely low. So they're basically banking on that you haven't ovulated, that even if ovulation is about to come, that you're stopping it, because that LH surge doesn't just happen like that. It takes time. It builds up, progesterone release, and then the egg is released. So that takes a little bit of time for it to happen. That's why you have to take it right away, so that you can stop that hormone release and for the egg from releasing. As far as women that are larger, they have, there's a lot higher likelihood of that not working, birth control not working, those things happen. The more adipose tissue that you have, the harder it is. Well, not the harder it is, but those levels are harder to mimic, because adipose tissue can cause issues, like not issues, but it just make it, the absorption rate is different. So if you are, over 150 kilos or 300 pounds, closer to that point, I would just say don't use Plan B as your primary method of birth control. Don't get to the Plan B stage. Be very proactive in not getting pregnant by using more reliable forms of birth controls. Plan B is an emergency contraception. Use it as such. Don't use it every single month like it's going to just save you. Next, how long should you stop using birth control if you want to get pregnant? It depends on what birth control that you're taking. If you are taking Depo-Provera or the shot, you should stop well in advance. Like, it could be up to a year before you get back into an ovulatory cycle after Depo-Provera. So it up to a year. Some people can get back into the ovulatory cycle right away. Some people take several months. It just depends on the person, but it can take up to a year. So if you're really, really, really trying to get pregnant in a particular time frame, I would end Depo earlier. Birth control pills are much more shorter acting. So just why you have to take it at the same time, every day at the same time, whatever, because their half-life in the body is lower, right? Meaning that you metabolize it much, much quicker, right? So if you take a birth control pill, in 24 hours, it's already metabolized. That's why you have to continue to take it to keep those levels high. Depo stays at a very high level over that 3 times. It dissipates over time, but it continues to prevent ovulation, and it can do that if you take it for an extensive long period of time. And then for it to really get out of your system, it's going to take that 3 months after the shot that you've taken it, and then it may take months after that to get back into an ovulatory cycle if you've been taking it for an extremely long period of time. So again, so all of that to say, it really depends on the birth control, but typically most of them, minus Depo, as soon as you stop them, you have the ability to get pregnant within weeks to months of stopping them.
What is the best birth control for perimenopausal women?
I would say non-hormonal. So if you're perimenopausal, if you're perimenopausal, honestly, the best thing would be to do an IUD, something that if you want something actual to place the device in your uterus, there's minimum systemic or the ability of the medication to go throughout your whole body. The medication is really doing its business in your uterus. That's really what you want. You don't want a systemic or widespread utilization of that hormone throughout your body because there are risks associated to it. But if you are really, really, truly done with having children and you want a permanent sterilization, you can always remove the fallopian tubes. That is surefire. You will not get pregnant after that. So that really, honestly, is the best thing if you are certain you don't want children anymore. It is an outpatient procedure done very easily, quickly, and you don't have to worry about anything after that. So I would say that's the best. But if you don't want that and don't want a procedure, then IUD makes sense.
Can birth control help shrink fibroids?
No. So there are hormone suppressants that can shrink fibroids, like Lupron, like Danazol. There are very harsh medications that can shrink fibroids, but the caveat to that is, one, you can only use them for very short periods of time. Two, they're usually associated with major side effects like menopausal symptoms and things like that, because they really cut your ovaries off. So when you quote unquote shrink fibroids with medication, well, you got to ask yourself, what is the goal? What is the purpose? If your goal is like bleeding, pain, all those issues, all that stuff is temporary, right? So once you stop taking the medication, then what? So it's just, and then again, you look at the side effects and all those things. So yes, in answer, there are medications, not particularly birth control pills, because birth control pills are not going to do it, but there are medications that can shrink fibroids. But those are heavy hitter medications. Those are not normal birth control pills or Depo or anything like that. They're medications that are pretty much designed to cut your ovaries off from producing hormone, which will help with shrinking fibroids. But then you got to get off of them after a year, 18 months, and then they're going to get right back. What else?
Do contraceptives increase the risk of breast cancer?
So it depends on what contraceptives you're talking about, right? So your estrogen containing birth control, like birth control pills, patch, those things have a slight increased risk of breast cancer, very slight, but they also have a decreased risk of ovarian cancer, right? So they decrease your risk of ovarian cancer, they slightly increase your risk of breast cancer, but the progestin only contraceptions don't have that same risk value. But with that being said, the risk of those is negligible. It's not like all women with breast cancer or a majority of women with breast cancer were on birth control. It's not like that. We're talking not negligible, but very small, but clinically significant increased risk of breast cancer. But on the same token, decreased incidence of ovarian cancer on top of it. So it's like, one or the other. What else?
All right. What are your thoughts on continuing birth control at 50? My doctor put me on them to regulate my heavy periods. I take them to not have periods.
Oh, I disagree with it. Strongly disagree with it. If you're having heavy periods, putting you on a systemic birth control, which again, once you are at an age, once you're older, like there are risks associated with any medication that you take. The older you get, those risks typically increase. So when you are on birth control pills, with estrogen in them, there's still risk. There's even risk when you're young, right? There's risk of blood clotting. There's risk of thrombotic events. So my patients that know that they don't want children, that are having abnormal bleeding, there are other things that you can do minus hysterectomy. You don't necessarily have to have a hysterectomy, but there are other options to actually treat your bleeding. Endometrial ablation is a major one, where you burn the lining of the uterus. You stop pretty much having periods or have really decreased amount of bleeding until you get to menopause, and you don't have to worry about the side effects or possibilities of bad things happening with birth control. So with my patients, if you are, past childbearing years and are having significant bleeding, birth control pills are like my last option. I would talk about some of the other things. And if you're going to do birth control, if you're going to do birth control, I would recommend progestin only birth control, like an IUD that only has progestin, doesn't have estrogen in it. Like Depo-Provera that does not have estrogen in it. Those medications have less risk associated with it than an estrogen containing birth control.
All right. And you want to hop in the live, please feel free to send a request to Dr. Johnson and he will let you join the live. It's like you get a free consultation on the spot. You're welcome to ask any question you want. If you're submitting questions, please put them in the box on the screen with a question mark. Some of the times when it scrolls on the screen, I can't scroll back to it. So I don't want to miss if you have something. All right.
Yeah, I ask you some questions.
Me? Oh,
Yeah.
yeah. You could definitely ask me questions as
Please.
well. I am open for the free game as well. So if you have questions regarding my experience, if this your first time and you don't know my experience, I suffered with advanced fibroid disease for a long time, and I had a decent size. I knew you was going to do that. I had a decent size removal. I opted, I opted to go with a hysterectomy, removing my uterus only. I am about 2 years-ish post-op. And sometimes people definitely have a lot of questions of what is life like after hysterectomy, especially if they're done having children. So if you're not done having children, obviously my journey is not for you. But if you are done having children, people hear a lot of rumors of the horrible things that are going to happen to you. And I probably should have asked my daughter, what has she noticed different about my life? Because now fibroids don't just affect the person dealing with them. Obviously we are affected the most, but it also affects the people around you. And I always try to get Sean here, but he likes the gym like Dr. P.
Mm-hmm.
So I'll be wanting him to answer some of the questions of how does it feel, or how is it different now living with someone who's not dealing with that, or because your family suffers for you too, especially if they feel like you have an issue that they can't help you resolve.
What was I about to say? I was about to say something. I just lost my. Oh, your girl did good, by the way.
Yeah.
And I had to get on the video chat with her little friends that said that she shouldn't come. So
okay.
It worked out.
She did. I did read. Well, yesterday was her birthday. Tuesday or something was her birthday, so I did follow up. But she did tell me everything went well. I told her I already knew.
Yeah,
you was in there.
She good.
Yeah, that's good.
She good.
Amazing. I'm happy for her. I told her today is the first day of the best years that's gonna come.
And it was rotund. It was big.
Okay.
But it all worked out. Other questions. So can you take out, oh my God. Okay, let me do this. Shrink fibroids. Can you take out any size fibroids laparoscopically? I can, but I don't recommend doing laparoscopic myomectomies. That's a problem. So I talk about this all the time. Laparoscopic myomectomies, you can't feel the uterus. You leave fibroids behind. That's how they come back. That's how they get bigger. You need to get them all. When you do laparoscopic myomectomies, you cannot feel the uterus. Plain and simple. In addition to that, you do all of these small incisions to do a very, very difficult surgery, and then have to turn around to do a C-section, because once you start cutting into the uterus to remove fibroids, you're obligated to have a C-section anyway. It makes more sense to make a small incision, very low, remove all of the fibroids, reuse that same incision for C-sections. But laparoscopic hysterectomies, I do all the time. I've not done an open hysterectomy in over a decade. It's since residency. And I've no open hysterectomies. All of them have been laparoscopic or robotic. So it just really depends on what you want and what surgery you're getting. When should a female start seeing a gynae? The answer to that question is when she starts to have gynecological issues. So that can be as early as 16, 17, where she's having very, very abnormal periods, or sexually active and looking for birth control or what have you, things that the family practitioner or the general doctor may not be very comfortable with. It's an opportunity at that point should transition over to a GYN. That's not even at a particular age, but if you want to age, then it's 21. That's the age of the first pap smear. But up until 21, you can see your regular pediatrician, as long as they can do it up to 18, but it just really depends on when you first start to have GYN issues that need to be addressed. Somebody want to hop on here. Let me see.
All right.
I'm trying to accept her. Let me see these other questions. She coming.
No. Hi, can you hear me?
Yep, we can hear you.
Okay. So I'm not sure what I'm doing wrong as far as the camera is concerned, but that's fine. So my question is, my daughter is 22 years old. Believe she may be sexually active, but she uses birth control as a form. That was a part of my question. I actually put it in right after someone else, and you answered it. But my next portion of the question is, so she used birth control to kind of try to regulate her period. But my concern as a parent is she's never been to a GYN, and so I wanted to know, do you have any suggestions of things that I could say to her? Of course, I'm not in the medical field, to help her to understand the importance of seeing a GYN instead of going to a primary care doctor and listening to them, and they are giving her birth control simply to regulate her period because it's extremely heavy.
So just telling her that bad things can happen, right? So once she, becomes a woman, an adult, outside of pregnancy, there you go. Come back around.
Sorry about that. I had to figure out what I was doing wrong. Okay, I see now what I'm doing wrong. All right. But anyway, so you said, I have the camera turned around. Don't worry about it, though. Seeing me is not important. I need to understand your response. I'm listening.
So with that being said, letting her know that bad things can happen, right? There are women in their early 20s with breast cancer, women in their early 20s with ovarian cancer, right? There's no age to say, oh, now you're 25, now this is when bad things can happen. Things can happen early. So I would recommend that once she starts having pap smears, cervical cancer is another one, right? So she should be having years, according to ASCCP guidelines, starting at 21. Right. And if she has abnormal pap smears, which high risk HPV or any other cervical dysplasia early, she needs to have somebody that knows what they're doing to deal with that. So just letting her know that there are other things outside of periods, outside of pregnancy.
I don't know how to work social media, as you can see. Don't laugh at me.
Don't worry.
I literally just figured that out.
I had to learn too.
Cola just learned yesterday. Don't worry about it.
But in all seriousness, it scares me. At first, of course, we talk about everything. She talked to me about sex and things of that nature. But when she said to me, oh, because I thought she was taking the birth control because of, sex and preventing pregnancy. And she said, oh, no, I'm taking them, for to regulate my period. And I'm like, what? It's time to see a GYN. And, and
Yeah.
just trying to get her to understand, she just wasn't hearing it.
Right.
And I'm
That's
just
how,
like,
that's
okay.
how, I mean, we people have to understand that, like, as doctors, we know a little bit about everything, but we're experts in what we are specifically trained to do. Like, do I know how to treat, flus and, headaches and things like, yeah, I have general knowledge of them, but that knowledge is limited. So if I
Right.
have concerns about like some of the general health issues, like for instance, somebody has thyroid issues, right? I know
Mm-hmm.
at work, but how to follow it, what specific labs to look at, when to get, labs on top of labs on top of like I don't necessarily do it. That's not my wheelhouse. So
Right.
when someone use, I send them to a family practitioner. Same way when a family doc is like has those questions, yeah, they can give you birth control pills, but what happens when you're bleeding outside of the birth control pills? What happened if you say, oh, I feel a lump in my in my ovary, or like something like that, to the point where they are not comfortable anymore? You have to have somebody that's comfortable, because bad things can happen really, really quickly. So just in direct answer, when you start getting sexually active, if you're taking birth control of any sort, right, go to
Mm-hmm.
somebody that with birth control and knows birth control in and out on a regular basis. It's not just benign. It's not just taking a pill. Like, there's side effects to birth control. I've seen young women get blood clots and lung clots and have major issues from taking birth control, right? So you need to have
Okay.
it knows your body type. It knows like which birth control pills are should be given to you, designed, and they're all built the same. So it's multiple different things that we know that your typical family doctor doesn't, and vice versa. There's multiple things.
Absolutely. And I've been trying to get her to understand that. She trusts the family doctor. I go to the family doctor as well, but not for GYN concerns, you know? And so she really trusts the family doctor because they've been able to help her through some other things. And I keep saying to them, but they're not a GYN. They're not the specialist that you need to see. And so I'm going to take your advice, as you said.
Typically, like, if doctors are honest, which some of them are not, but if they're honest, they will say, listen, this is a little bit more than I want to deal with. I can refer you to my colleague, as you, because I do that all the time. Like, somebody come in like, hey, blood pressure's all out of control. I'm on this.
But we know you different, Doc.
I'm like, I ain't, you ain't
You different
about
from most doctors. I've said that to you before.
yeah. But that's what has to happen. Like, you have to
Yeah.
they have.
Okay. Well, I won't hold you up. This has been good. I didn't think about, because I didn't think about those things because I figured that may scare her to talk about what, the negative things that could happen that could impact her body. But I'm going to try it because I just don't think it's a good idea.
And she worried about like pelvic exams and speculum exams and stuff.
Yeah. I think that's what she's afraid of. And I've tried to explain everything to her. I'm that parent that's like, listen, this is what's going on.
I'm that patient though that was the same way, so I can relate. Like, I was like, I'm not dealing with a gynecologist unless I'm pregnant. Like, I didn't want to deal with them. I was afraid of them completely. But what I found out is that if you find somebody that you trust, or like you said, she's comfortable with, then that makes the most difference. Because even my family care was always telling me, like, I'm not a specialist in that area. Like, I can tell you this, but I'm not a specialist. And she kept, was saying, like, you're going to have to do something about those fibroids. Like, I can't take you through that journey. And I was like, you sure?
I watched your journey. I definitely watched y'all through. I'm super excited for you and happy for you. You're welcome. So yeah, I won't hold you up any longer. Thank you. This was very helpful because absolutely. All right. Have a great evening.
You as well. Thank you.
Thank you. You're welcome. So I don't know how.
Oh yeah, he take care of it.
So you meant lap hysterectomy? Yes. That's my wheelhouse. I do not do open hysterectomies. Everything is robotic. Everything is laparoscopic. I pride myself on that. I struggle because people like Cola come to me with carburetors for uterus and fibroids and be like, take this out with a small incision. Okay, Cola. No problem. So that's what I do. But yes, any size. I literally like, what's the biggest one? 3 weeks, a couple weeks ago, I don't remember. A couple weeks ago, I took out 8.5 pounds robotically. I took out 7.5 pounds the week before that. I probably took out, she probably is like 6 pounds yesterday. Like, so everybody comes to me is typically at least 5 pounds that I'm doing robotic surgeries on. So it doesn't get much bigger than that. Usually it's like 8-9 pounds really is the cutoff, but it can get bigger than that. But usually that's it. But you're not gonna find too many, well, I don't know any that are going to do that. Not to just say, like, talk about myself, but it's just a lot to do. But I think it's important to do because of the recovery and what it means to people. So that's why I do it. But don't be surprised if you go to multiple gynecologists and they tell you absolutely no way, I'm not doing that. Like, it's difficult. It's not an easy thing to do.
Yeah. I didn't get to what type of surgery, but I definitely visited others that was like, you having surgery. It ain't no way around it. So get your mind right. But you always says led with non-invasive. The rest of them wasn't necessarily leading with that. They didn't get into specifics, but they was definitely not leading with non-invasive.
Yeah. So
all right. I hearted the ones that I asked for. What is the reason some non-diabetic women have yeast infections the same week, monthly, prior to their period?
I would say that I would have to ask you, are they really being diagnosed, or are you just feeling symptoms, or are you going off a smell, or if you're going off a feel? Because a lot of times it's happening to where you think you have a yeast infection and you don't. So yeast infections or infections don't respond like that. They don't just like come and then go. Come to here and then they go on their own. Doesn't really work like that, right? So when you have a true infection, like, you got to treat it and fix it. So you see that it's like cyclical symptoms, but you're not really taking anything, and it just kind of goes away on its own, then chances are you didn't have an infection. You just had, just a symptom of what you were going through. So I would say, one, get tested to make sure that it's a true yeast infection first, and then you can start to answer questions of why things are happening. But a lot of time, women, and I'm sorry, y'all do this all the time, y'all very neurotic about smells and how it reacts, and this ain't normal, and all y'all very, very neurotic about those things. And a lot of times, you don't realize that blood in the vagina, periods, i.e. periods, stinks. It's an acid and a base mixed together. It can stink. Semen in the vagina stinks, right? Like, those are things that are basic, that are in an acidic environment, that can stink, but it doesn't mean you have an infection. Even though you think you may have, and you may take, all of this, sea moss, boric acid, and everything else that's floating out here, and stick that up your vagina, take it, do all the stuff you do with it. It does not necessarily mean that you have an infection, or you should be doing those things on a regular basis.
And watch out being victims of community penis.
Oh my God.
That's my number one. If you uncomfortable all the time, watch out. I know you don't agree with that because you be riding for the dudes, but I'm going to say you might be a victim.
I'm gonna leave that.
You're going to be quiet on that one. I'm just saying, from a patient perspective, watch out for being a victim of community penis. That can definitely cause a lot of uncomfortable behavior.
That's hilarious.
Would using birth control over an extended period of time have an impact on you getting pregnant?
No. But it also depends. Like, if you use, like I said, if you use Depo-Provera for an extensive period of time, it may take longer for your ovaries to recover. May take, up to a year for your ovaries to recover to start getting back into an ovulatory cycle. But they do recover as long as you're not in menopause and as long as you're not having other issues. They should recover from that. So yeah, using birth control doesn't stop you, but age and other things can, cause more of a barrier to getting pregnant. If you taking, you 32 and you took birth control for 10 years and you getting off at 42 and you're trying to get pregnant, it's not so much you being on birth control for 10 years. It's more so that now you are 42 and you having issues with your ovaries now because you're a little older. So y'all know
Because
what you talking?
people was in the comments. That's why I'm laughing. They was like, not community.
Mhm.
That's why I said the women on here understand what I'm saying. You gonna rap for the dude.
I'm up here talking. Oh, they up here
I'm just saying. You gotta be careful. You could be a victim. All right. Any recommendations on someone who has umbilical hernia and fibroids and need them removal? What is the best way to tackle both? 2 separate surgeries? Question mark.
So if you're doing a myomectomy, a myomectomy is going to be a little bit tougher, and it really kind of depends on what size your fibroids are. So that's a you would have to hop on here and I have to ask you questions to really get into that. But if you were doing a hysterectomy, which you could do robotically, you can have 2 surgeons simultaneously, which I've done with another general surgeon, where I did like my robotic portion with the hysterectomy, and then they came in with their robotic portion and did the ventral hernia or umbilical hernia repair with mesh. Like, so you could do that. When you have a myomectomy, it makes it a little bit more difficult because now you have to remove those fibroids, and then you have to, which is hard anyway from doing a robotic myomectomy and then adding a repair of umbilical hernia. So that's a lot. So it really kind of just depends on the surgery you are seeking from the hysterectomy portion. The hernia portion is a little bit more straightforward. They could do hernia surgeries, relatively easy with laparoscopic approach, but when you add in a fibroid removal on top of it, or myomectomy on top of it, that makes it more difficult. But it can be done, but you have to Jesus Christ. But you have to you have to have somebody very skilled and that's going to work with you, and get another person that's going to work with you. So if you're going, that takes some work to look for. It can be done, but it takes some planning and some work to do.
All right. Is not being able to have an orgasm a physiologic problem or a performance?
Yeah, it can be, but it also can be a lot mental as well. So a lot plays into that. It is a physiologic aspect where it could be size, it could be where women have different erogenous zones. Everybody is not the same. So understanding your anatomy, understanding, clitoral stimulation versus vaginal or penetration, or like understanding all of those things and being able to communicate that with your partner and actually like your partner enough to be mentally invested enough for that to happen. A lot of that is. Oh, let me answer this real quick.
Okay. All right. So if you're just joining, I was a little late today, so I don't know how long they've been on, but you can still put your questions in the question mark on the screen. You are more than welcome to send a request to join the live. And it's almost like you get a free consultation on the spot, because he can ask you all the questions he needs to about your specific situation. Or if you have something that you want to share about a medical experience that you have had, you are also welcome to share an experience as well. But if you have questions tonight, drop them in the chat. And if you want to join, definitely feel free to send a request to join the live.
All right.
All right. Another orgasm question. How long can you wait to pee after sex? If I need to pee during intimacy, it will interfere with my orgasm. Can you just drink the water after and then pee later? I guess because one of the lives we was talking about, you should pee after sex.
Yeah, you should.
Yeah. So they saying, well, how long can they wait to do that? Because they don't want to have to go while they in the middle of it.
You don't have to go in the middle. Go after. But if you have to urinate while you're doing it, it will impede orgasm, though.
That's what they're saying.
Yeah, it will impede that. So like you know.
So they
same
asking,
way.
how do they time? No, how can you drink the water after and then pee after?
Yes, you can, absolutely. But it's also good to pee before too, because you don't want to have to pee when you're having sex. It's going to impede your orgasm. But yes, you can pee after intercourse, absolutely. It just decreases the risk of urinary tract infections because the urethra is so small and so short, not small, but short in a woman. So it's easy for bacteria to ascend up. So it's recommended that you urinate after intercourse to decrease that risk of urinary tract infections. But yeah, you can definitely wait after. You know, I wouldn't say wait 3 hours.
Yeah,
after, you know.
that's basically, I guess that's what
Yeah,
so that's what they said.
Don't wait.
How long can you wait? Because I would prefer to drink the water after.
You can sit there and bask in the glory for 10-15 minutes. After that, I would get going to urinate and then come back and lay down and do what you do.
Okay.
Somebody came up on here. Hold up. Try this man super slow today.
Hello. Hi there.
Hi, how you doing?
How are you?
I'm fine. I was just listening. I really didn't expect to come on live like this, but
you hopped on it. You requested it.
I didn't even have a question. Honestly, I don't know who I was looking at. I was looking at the fibroid saying. I was like, dang, I was just told not too long ago that I had fibroids. And I was wondering what was going on with me. I didn't have a menstrual cycle until, the last one I had was in January. And then I had one this week. I'm just like, I thought I was starting menopause. I'm 47 years old, and I thought I was starting. And all of a sudden it came. I'm just like, oh my gosh. And it's been so bad. It's been so painful. I mean, painful like in high school, taking Pamprin, not working. Feel like I'm passing kidney stones, painful. And it's the 4th day, and I'm still having pains in my back and going on my hip. It's like, why am I having so much pain? Is it because of fibroids? Is it because I hadn't had a period in so long? What's going on?
It's unlikely that it's fibroids. If you have fibroids, those fibroids have been there for years. So, I don't see very often women in their mid to upper 40s that have had either normal periods or have had decent periods for a majority of adult life, and their reproductive life start to have horrible bleeding symptoms. Fibroids typically happen over a significant period of time that happens. So most likely, from the beginning, it's perimenopausal and ovulating bleeding, meaning that you're not ovulating normally anymore, and your body's kind of off kilter because the hormone decline is happening, and that's a lot of times what happens. And what I see that's problematic a lot is that women go to their gynecologist and complain about these things. Gynecologists do an ultrasound, see fibroids, just because you have fibroids, mistake, not understanding why you're eating, automatically rushing you back to surgeries just because you now
Right.
picture of you just started having these symptoms, these fibroids been here a long period of time. There's something causing you to have that, and there are other treatment options for that other than fibroid surgery. You know, I'm saying
Right.
just know your personnel, know who you're going to, make sure they explain things and understand what's happening and make it make
Right.
sense to you.
Okay.
Cool.
Thank you. I appreciate that.
Very well. Thank you
For
for
hopping on.
Thanks.
she wasn't ready for that.
Right. She was like, what I pressed?
I tried that question.
Can you say a little bit though about your answer, because with her TV for us, it was breaking up. So you were basically saying that you highly doubt that it would be
right. So fibroids, when women have problems with fibroids and bleeding, they have it over a long period of time. Like, fibroids just don't come up like that. So if you're in your mid to late 40s and you're just now starting to have bad bleeding, and before that you were perfectly normal and it just happened all of a sudden, yeah, you may have fibroids, but it's highly unlikely that those fibroids are what's causing your bleeding, right? You have to look at age, look at the bigger picture. Women with fibroids and problems from fibroids have this stuff earlier in life, and it's over a significant period of time where it gets worse and worse and worse. It don't just happen acutely like that. So when you have that in someone that's in their mid to late 40s, 90 times out of 100, it is because they are having anovulatory bleeding, like I was saying, perimenopausal anovulatory bleeding, which is causing them to get heavier periods.
okay.
What else? Couple more.
Yeah, that's what I was gonna say. What we looking at? Cause since I was late, what we looking like on time?
Yeah. We got like 7 minutes.
Okay. Is it truly safe to have sex during your period?
Yes, it actually is. It's when you want to talk about like birth control, that's probably one of the most effective forms of birth control there is, because it's very difficult to get. It's rare, not say difficult, but rare to get pregnant while you're on your period, because there's just you're not ovulating. If you're having periods, or if you're on your cycle, it is very unlikely that you are ovulating, and so it's difficult. And then in addition to that, blood is not it's kind of like toxic for semen as well too. So it's a transport problem as well as no egg to ovulate. So yeah, it's safe in that regards from pregnancy. Do I take people with health insurance? Absolutely, I take people with health insurance. It just really goes like this. I offer mine because people like start freaking out about like the consult service and online or what have you. That is just offered for people that are not here that can come and see me. So, that consult, me sitting up here talking to you at 8 o'clock at night, talking to you about everything, going through all of these issues and having those consults, I offer to people that can't come here from out of state and other places for them to be able to have those consultations. That's really the only out-of-pocket thing. Everything else is through your insurance. So if you come see me in person, if you're local, or if you're having surgeries, or if you're flying in having surgeries, or if you're flying in having telehealth visits or what have you, those all of that stuff is covered by your insurance. The only thing is not is like just the telehealth visits that I do that I offer women that can't come in person. Those are out of pocket. What else?
All right. Can you get an STD from a toilet seat in public?
No. Well, I take that back. You can get crabs. You can get, lice and things like that. Those aren't necessarily STDs, but you can get those from like touching. But HIV, gonorrhea, chlamydia, those things, no, those are really bodily fluids. You're not going to get an STD of that nature that way. But that doesn't mean you can't catch anything from toilet seats. You can't get certain things, certain parasites, bed bugs, lice, those types of things can be on toilet seats. So gotta be careful when it comes to that.
So if they suggested the toilet seat was the root cause, I heard
Yeah, I got
they
maybe
got
from
community penis. They lying. That's what I heard.
you can use that as an excuse if you want to, but probably not.
Not if you got a doctor friend that'll tell you the truth.
Right.
All right. Do you take people? Okay, you answered that one. That one.
Is it true that fibroids can terminate a pregnancy? Yes and no. Fibroids have to be really, 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 really big, or they have to be in a bad location, pushing into the cavity, which is more so how it can happen where they're taking up the cavity. You have an implanted embryo there that's forming placenta, and it's stopping the growth of the embryo in the cavity. It just doesn't have the space to expand, and it doesn't have like the surface area for the placenta to continue to expand. Like, so that can happen. But typically not. I deliver and have women with fibroids have children all the time. It happens. Like, it's not a death sentence for your pregnancy if you have fibroids.
I have blood clotting problem. Is it wise to fly to get surgery?
Yeah, you can. I mean, you would fly to do it. You're not going to not fly any other time, right? So with my patients that fly in for surgery, I put them, whether they have blood clots in the past or have not. I put them on anticoagulants or blood clotting medications when they fly back home. I have a lot of patients that are flying in from out of the state, and all of them are on anticoagulants or anti-blood clotting medication getting on the plane. But even with that being said, I still also encourage them to, if you're on a plane, stand up, do toe raises every hour and a half, 2 hours. Like, don't just sit there for hours and hours, because whether you sit on a plane or whether you just sit at home, just not doing nothing for 3-4 hours, like, there's a possibility of getting blood clots, but you just have to be cognizant of that and just kind of, do toe raises, stand up, get active. You could do that on a plane the same way. That's better than getting cut open or whatever. If that's the alternative, then, it's better off flying.
Why would someone have horrible menstrual cramps after not having sex for a very long time?
That can be multitudes of different reasons. Yeah, I'd have to look at ultrasounds and look at what particularly you have. It may, there's something to it there, It's something else that's happening. So I would recommend ultrasound and actually seeing what's what. Yeah, I would, yeah. You need an ultrasound. You need to be examined.
All right. Do you want to tell where you're based out of? I did put your personal consultations on the free game, because you got a lot of people that reach out from all over now.
Yeah. A lot of times they look at that and they just still where you at? They go put it right there. But I am in Chicago, Illinois. I do virtual consultations, inpatient. People fly in for surgeries every week now. Now it's gotten to that point where it's like every week somebody's flying in from out of town for surgeries. So don't let that be a barrier to you getting the care you need and deserve. Like, if they're offering what you need where you're at, God bless, stay there. You don't need to come here. But if they're not, that's my thing. Like, I don't want anybody to have to endure or suffer bad care because they just don't have the access to somebody that's going to listen to them, preserve their uterus, do minimally invasive things or what have you. So that's why I'm available. And, people fly for BBLs and tummy tucks and fly for everything else under the sun. You should fly for stuff that's actually going to matter in your life and could possibly harm you, kill you, or cause you significant impact on your quality of life. It makes sense. So that's what I offer. You know, I'm here. The link to my website is in my bio. Um, you know, and yeah, I talk to people all the time. Just had a consultation before I got on here. Once you have a consult with me, you pretty much have access to me. Like, I don't just be like, oh, well, you got to go back through the channels or whatever. Once you consult with me, you can shoot me a text, shoot me a DM, and pretty much, and I'll answer it too. So people like, oh, well, insurance gonna pay for it. I mean, that's fine. But, you know, at a certain point, if I'm gonna sit here and talk to you for hours and then give you access to me, like, Jesus, like, I don't think that's that bad. But, you know, people are people. It is what it is.
It is definitely worth the I mean, I didn't have to travel, I guess, but it's definitely worth getting your life back, because you will feel completely different, especially if you've suffered for years like he described, because I can relate to that firsthand. All right, so you want to end and we do it again next month?
Do it again next month. Stay tuned. 521.
Oh yeah, do you want to talk about your?
Yeah, I'm super excited, super stoked.
Yeah, let's end on that note. So tell us about the Fibroid Slayer coming to YouTube May 21st.
So the episode is done. Like, you'll see another, like,
May 21st, right?
May 21st.
May 21st.
So I'll put another clip on there to, like, draw people to actually see the whole thing. But it's super dope. You know, the whole premise behind it is that I had an idea. You know, it's like, it's a lot of garbage on TV. I'm doing a lot of consulting about fibroids, surgery, everybody complaining about, you know, the healthcare for women and all this stuff, or what have you. And I was like, well, why not talk about, you know, women's healthcare and fibroid surgery is such a problem that's in our community. And since I'm doing this, not many people are doing this, why not make that a show? And so there are women that are flying in from all over the country. I'm removing 6 pounds, 7 pounds, 8 pounds, 9 pounds, 13.5 pounds worth of fibroids. And it's pretty damn interesting, and letting women reclaim their lives and reclaim, you know, take control back of their independence, and, you know, giving them opportunities that they didn't otherwise have. And so I was like, that would be a dope show. And not only would it be a dope show, but it will also give other women confidence to be able to seek treatment and care for that too. So since I am the Fibroid Slayer, I was like, I'm gonna have my own show. But then when I had the concept out, the concept was like the networks. I had a producer that was like, had it, and like, they were, you know, talking about it, and they was like going to like these different networks. They was like, it's not a great idea. And I don't take no for an answer. I was like, I know this is dope. So I was like, I'll pay for it myself. I'll do it myself. Like, you're not gonna tell me no. So that's what I did. I'm my own production team, and just filmed my daily life about what I'm doing. And now I put it out, and I'm like, damn, that's dope. Here come these networks. Like, oh my God, this is the shit that I just told y'all months ago. But now that you actually see it, now the price is going up. So now I'll put it out myself, right? And have these episodes. The first episode is gonna be super dope. So like I showed y'all, like, I operated on twins, which I don't know anybody's ever done that. Like, taking all these fibroids out of twin sisters. Like, they was super dope. They was really game. We did the footage of everything. So you're gonna see surgery, you're gonna see them having their like dialogue, their interviews, and after surgery and all the stuff they went through, and then with me, with my family, and all of the stuff that I deal with, go through, what have you, putting it all in the show. It has a lot of just real life, interesting, like, stuff that's happening. Not a bunch of crazy drama and people throwing stuff and smacking each other, but it's stuff that, you know, we all care about and are interested in, especially Black women. You should be. So yeah, so that's coming out to start off on May 21st, and it's gonna be episode after episode after episode. Then when I get all of the followers on it, then here comes TLC and the OWN network, and hell, they'll come. And then, you know, I might
That's
be like,
how they go.
Yeah, that's how I go. Like, when it start rolling and it gets big or what have you, then here they come. So, but you see, it's gonna be high quality. It's gonna be super dope. I'm very excited about it. The episode is like done. It's just waiting to be released. That's it.
So where the viewing party at? Where the
one of my patients, she was like, you gotta have a viewing party. I'm gonna do it. I'm gonna do a viewing party. I'm gonna make it happen. So I gotta start planning that like
Uh,
ASAP.
yeah, it's like
Yeah. I ain't think
20
about
years.
it. I was like, nah, some people will be saying like, oh, I watch that in my free time, spare time. Like, nah, everybody's like, gotta have a viewing party, gotta have a. It's like, all right, fuck it. I'm gonna do a viewing party.
Well, I mean,
Um,
they probably like the episodes later, but the first episode, you always gotta like
gotta
drop.
do a party.
Yeah,
All right, it's gonna happen. Okay, gotcha. Yeah, I'm gonna do it. I'm gonna do it.
that's what's up. It's a Sunday fun day too.
Yeah, Sunday fun day. I
Well,
think that was it.
that's awesome, and congratulations. You definitely deserve it. And ain't nothing wrong with investing in yourself, especially if you already know what you worth.
Absolutely, and it's just like when you believe in something, man, you just gotta invest it. I believed in it. Like it was a idea and a concept I have, not just for myself, but just to, doing all of these lives and stuff. And like, so people are tuning in, and the people that are here are invested, but there's so many people that need to hear it that are not hearing it. And the only way you could really do that is to get on TV, is to like have a bigger platform. So I want the information to be able to get out there and know women have options to for their health or what have you. So that's what I have to do. So it's
Yeah,
coming.
I think, as a matter of fact, I do have a message somebody has sent me about that too. Like, I bet you never knew going to the doctor was going to turn into a monthly live or turning into
Look,
all of that. And I'm like, with me, hell no, I didn't think that, because I was way more scared than half of the people. And I mean, you scary is an understatement when it come to me, but the impact, because you always said it from day one, like, this is going to be great. You was absolutely positively right, because even people who not coming to you are like, I'm brave enough now to take care of an issue. You know what I'm saying? Because you said, do it, take your life back, claim it. You know what I'm saying? Sometimes they just hear somebody else and it just make that world a difference. So definitely. And I'm gonna post the message too. I always ask people permission to, if they share intimate stuff or whatever, can I post it? And she gave me the green light. So I will definitely post that and tag you in what she said about the work we're doing to, or the part, the stuff we started doing with the lives.
she said, what should be my next? I have largest subserosal lesion measuring 11, so that's about yay big. I got you. Just call me. Yeah, you need assistance, and I will fix that for you. Not a problem. But yeah, that's pretty big. But you have options. You have a lot of options. Don't let anybody tell you that you need a hysterectomy or that you need some just crazy stuff like happen. You have options. How long is the downtime for robotic hysterectomies? It really kind of just depends on how big it is. Cola had, what I call you, a carburetor.
You told me a studio apartment,
Oh,
a carburetor this week. Like the
like,
jokes never end. He got a new one every time we talk.
How long were you down? Give yours.
Okay, so I definitely had a complex surgery, over 6 hours, butt all scratched up. Just my surgery was extreme, and I still felt good within a week or two. I didn't go back to work for about a month, but my job didn't have like I was paid to be off with the recovery, so it was no urgency, but I definitely felt good once I got back home. I mean, like, you move slow, you do have tenderness where the action happened, but it's nothing like every day you in bed like, oh my God, where's my pills? And it's nothing like that. Like, you literally, like, I really was asking him, like, can I go? I got concert tickets. Can I go? And he was like, I don't see any problem with it. I made the decision not to because I was afraid if somebody bumped me just because. But other than that, I mean, like, you're really okay.
Yeah. And then somebody asks us, like, is the consult just for out-of-state patients? It's for in-state patients too. They just really, some people just don't have the time or don't feel like coming in to be seen or whatever. It's a way to, and then also too, don't feel like waiting on appointments. It just might not work. The consult is just for your convenience, for you to be able to access it. So you can be local and do the consult, but more so for the out-of-state patients. If you are local, you are free to come in to see me in person. I'm in clinic Mondays and Fridays. I'm not just trying to take your money. You can come in Mondays and Fridays. You don't have to go through the consult service. It's perfectly fine if you can come see me. If not, and you like, hey, I don't even feel like going over there or whatever, you know, do the consult service, you can. It's whatever you want to do. So after robotic surgery to remove fibroids, one, I'm not removing fibroids robotically. It's open surgery to remove fibroids, but removing fibroids in of themselves, you should wait 6 months to get pregnant, minimum. I think that's Patrice there. But yeah, 6 months minimum. But again, with if you get a robotic myomectomy, realize you're going to have a C-section anyway it goes. It makes more sense to go and get all of the fibroids and use an incision that you can utilize for your C-section in the future. But that's my 2, 3, 4, 5 cents in there. All right, they're going crazy. Yeah. All right, so we got
of
your
course,
ass.
only because we said we
were
ready to go.
And
Now here
I'm going to hit y'all go with all these damn questions. So we're gonna do this next time. And so my next post, I really have to talk about UFEs. So my next post, and I'm taking time so I can put all of the little videos and little fun stuff in there so people can actually watch it. So that's why it's taking me time. But I have to talk about UFEs because I literally get a message every day. What about UFE? What do you think about UFE? Why I hate them. Okay, for everybody, I hate UFEs. I don't recommend them to anybody in my family. That's what you want to ask doctors. Like, would you tell your mama to get one? The answer is no. I would not tell my mama to get one. I would not tell my sister to get one. Will I offer it to you as an option? Absolutely, because I don't believe that any option should be cut off to you. So I'll tell you about it and I'll put it out there for you. However, I don't agree with them. I don't like them. Will they work for certain people? They have. But if you give me 100 people, only a very, very small minority, 10 or less, are going to have success with them. The overwhelming majority of them are going to have pain, and I'm going to end up doing surgery on them anyway. It's just not a good procedure. So the next post will be about UFEs. I have to put something because I want to have something that's there to just be like, I can just tell them, go see my video on UFEs because I don't want to answer that question no more. I literally get it every single day.
I think it's in at least 7 of our lives.
Oh my!
And we on part 17.
I got to do UFEs and why I don't agree with laparoscopic myomectomies. Those are the 2 things that I get all of the time.
Mm-hmm.
My channel is Pierre Johnson MD. I'm gonna post all of that stuff. You'll see, like it'll be all over. It'll be all types of promos for this episode, and I'm super excited because it's gonna be super dope.
It definitely is.
All right,
must see TV. All right, happy.
Well,
I will say it again.
Next time we're gonna be on time.
No. Next time, are you gonna be on time?
Because I done been late, so I got you.
Yeah, that's why I'm like, wait a minute. But no, I had to, duty calls. You understand?
Do what you gotta do. Shout out to my child for hopping on here.
Yes, thank you, Pearson, for filling in for your girl. I appreciate you so much. I was coming though. Your daddy just don't read.
Whatever.
All right.
Talk to y'all later.
All right. Be safe.
All right.
Bye-bye.